Thank you all for joining me tonight. So tonight I'm going to talk to you about nutrition in regards to cancer prevention. Just a little bit about me. I hold a master's degree in nutrition and dietetics from Marywood University. I've been a registered dietitian for a total of 11 years, and I've been a board certified specialist in oncology nutrition for the past 6 years. And like Parminder said, I've been with Valley for almost my entire career as a dietitian. So tonight, what I want to go over is foods to increase, because everyone likes talking about the things that they can increase first. Foods to decrease and avoid. The American Institute of Cancer Resources recommendations, and just resources for you at home. So starting with foods to increase, you want to increase your intake of fruit. You want to include fresh, frozen, canned, and 100% juice. I always say pick what fits your budget and pick what fits your palate. Fresh produce can be just as nutritious as frozen produce. Frozen produce can be just as nutritious as fresh produce because it's picked at the peak of ripeness and then flash frozen. So it's just as nutritious and can be a little more budget friendly, especially depending on the season that you're in. Canned can be a nice option if you need more of a softer texture. And if it's canned in 100% juice, it might be a better option for you. So what does one serving of fruit look like? It's 1 cup of fruit, half cup of dried fruit, or 1 cup of 100% fruit juice. When looking at fruit juice, you want to read the label and make sure that it's 100% fruit juice and not fruit juice cocktail. So fruit contains vitamins, minerals, and fiber. The USDA comes out with their list of nutrients of concern. So essentially, what nutrients aren't Americans consuming enough of? Potassium is on that list. So if you increase your intake of fruit, you will increase your intake of that nutrient of concern. We also know that, cold and flu season is around the corner with the weather. So fruit is a natural source of vitamin C, and the body does prefer the vitamin C from fruit. Yes, fruit contains sugar. Sugar is not inherently bad, especially naturally occurring sugars, because naturally occurring sugars come packaged with the vitamins, minerals, fiber, and all the phytochemicals that are in the fruit. If you have blood glucose issues, though, you may just need to watch portions and maybe pair it with something that's higher in fat and protein. When it comes to organic versus conventional, and this is all produce, not just fruit, both organic and conventional practices use pesticides. Organic uses organic pesticides, conventional uses conventional pesticides. Organic pesticides are a little bit newer, but both are regulated and both are deemed safe by the same agency. So either way you go, I always say pick what fits your budget, especially nowadays. Make sure you wash it under cold running water. You don't need any soaps or detergents or bleach or anything like that. Just cold running water will do. So some tips to increase your fruit intake include fruit at breakfast. Take fruit and nuts as a snack on the go. I know I always like to I actually keep a jar of peanut butter in my office, and I'll have like an apple cut up with peanut butter. Another tip is to keep cut up fruit in the refrigerator at eye level. So if you're someone who sticks it in the produce drawer and then forgets about it, what you can do is take all the condiments out of the side of your refrigerator doors, put those in the produce drawers, and put your produce in the doors. That way, when you open it, you'll see it and you're more likely to eat it. You're more likely to go digging for that ketchup or that mayonnaise or that condiment than go digging for the fruit. You also want to increase your intake of vegetables. Any vegetable or 100% vegetable juice. Same as fruit, it can be canned, frozen, fresh, or dried. Vegetables are divided into 5 subgroups: dark green, red and orange, beans, peas and lentils, starchy, and other. I'll give examples. So vegetables also contain potassium, vitamin A, and vitamin C. Starchy vegetables are commonly avoided. I know there was a while ago, everyone was talking about avoiding white foods, so the white bread, the white rice, white potatoes, but white potatoes are actually a good source of potassium, vitamin C, and fiber. With the starchy vegetables, again, people who have blood glucose issues may need to watch portion size and what they pair it with. Beans, peas, and lentils are a good source of fiber and plant protein. So if you're trying to eat more plant-based proteins, I would increase your intake of these foods. So tips to increase your vegetable intake. You can add vegetables to breakfast wraps, smoothies, or eggs. I know for a smoothie I used to make, it was Greek yogurt, milk, and then I would hide spinach with pineapple. Pineapple hid the spinach taste completely, and it was delicious. So finding recipes online of smoothies that contain vegetables offer a better balance of nutrients, especially if you're trying to avoid too much fruit in your smoothie. You can also add it to eggs. Add vegetables in an omelet, add to scrambled eggs, put scrambled eggs over a bed of vegetables. You can also add a variety to your salad. Try them sauteed or in a stir fry, and add them to pasta. One thing I always talk about is you don't have to have all whole grains when you consume grains. It is recommended to make half your grains whole, but if you're someone who really prefers the taste of the refined grain pasta, that's fine. The way to increase nutrition and fiber is to add vegetables to that pasta. That way you're kind of getting the best of both worlds. You can also add them to your snack. Use them with a dip with some fat for better absorption. So think about like a veggie platter with hummus or even ranch dressing. The ranch dressing or hummus will have that little bit of fat that helps with the absorption of the fat-soluble vitamins. Okay, whole grains. So that's your bread, pasta, cereal, grits, popcorn, rice, and oatmeal. There's 2 subgroups, whole grains and refined grains. Like I said, you want to make half the grains you eat come from whole grains. And the way to check that is just to read the ingredients label. If it says 100% whole grain, then it's made from whole grains. So grains as a whole contain fiber, B vitamins, iron, magnesium, and selenium. B vitamins help support a healthy metabolism. And if you consume plant sources of iron with vitamin C rich foods, you will get better absorption of the iron. Like I said, with grains, there are refined grains and whole grains. In the refining process, yes, it does remove a lot of the fiber and some of the nutrition as well, but they also add back some of the B vitamins and iron and magnesium. So the nutrition can sometimes be pretty comparable depending on what it is. So I encourage you, if you're someone who can't stand the thought of brown rice or can't stand the thought of whole wheat pasta, find other areas where you can add in that whole grain and then have your white rice or have your refined grain pasta and just add vegetables to it. So on to everyone's least favorite subject is foods to decrease. So we want to limit red and processed meats. Moderate amount of meat provides a good source of protein, iron, zinc, and vitamin B12. Vitamin B12 is not found in vegan diets, So if you are someone who is vegan or want to go vegan, you need a reliable source of vitamin B12. If you're a vegetarian, there is a chance that your diet does get enough vitamin B12, but there is also a chance that it doesn't get enough of B12. So I would have your doctor test your levels. For red meat, you want to limit it to 3 portions a week, and red meat is anything that walks on 4 legs. I know when I was growing up, there was an advertisement that pork was the other white meat. So people began believing, oh, well, pork is white meat, but it's not. It counts as red meat. So if you do like pork, that's perfectly fine, but count it into your 3 portions a week. We do want to avoid processed meats, and those are meats that are smoked, cured, salted, fermented, or have any preservatives added to them. Think like hot dogs and sausage and deli meats. That's because the method of processing them increases heterocyclic amines or carcinogens in them. So they've been linked to an increase in colon cancer and other cancers as well. So to get around that, incorporate more poultry, fish, eggs, beans, and soy. And I know one of the questions that I get asked a lot, especially from women with hormone receptive cancers, is soy safe? And yes, the research that's done in humans does show that soy is safe in moderation. The old rationale for avoiding soy was because they did the research in mice, and mice metabolize soy differently than humans. So the newer research is looking at humans, and it's showing that soy is safe and actually has a mild protective effect. So if you do like soy, you can consume soy safely. So tips to avoid red meat and increase other meats and other sources of protein in your diet. Use fresh roasted or baked poultry. So if you go to the grocery store and you see the rotisserie chicken, that does not count as a processed meat, and you can consume that safely. That's an easy option. You can slice that up. It makes a great dinner. You can also chop it up and add it to soups really quick if you need something quick and easy. You can also add nut butters, hummus, or other bean dips or spreads on sandwiches. You can also make your own breakfast sausages with fresh ground poultry, which I know it's not going to taste the same as the sausage that you know and love. But if you really want an alternative to that sausage, it's really easy. I've done it myself. Basically, I've gotten like ground chicken or turkey, added some spices to it, and you can either pan fry it or bake it in the oven. I've done both methods. If you need recipes, I would search online for them because there's so many, and you can kind of customize it to how you like it. So you also want to think of meat as a side dish rather than the main course. Alcohol. So for cancer prevention, it's best not to drink at all. The reason being is because alcohol in and of itself is a carcinogen, and alcohol also increases the permeability of your gastrointestinal tract. So any carcinogens that you ingest are more easily penetrating that GI tract. If you do choose to drink, moderation is key. 1 drink for women, 2 drinks for men. Try and limit it to 3 a week. So some tips to decrease your alcohol intake: sip slowly and alternate with water. Avoid doubles. Try a mocktail. Replace with club soda and a splash of fruit juice. And yes, it is best to not to drink for cancer prevention. I know they talked about alcohol for heart health, but there really hasn't been any safe level of alcohol established. So I started to talk about sugar a little bit before. Sugar in and of itself is not inherently bad. It's just when we consume too much sugar, where it adds up to excess body weight. It can be a quick source of energy. So if you are an athlete, it can be really great for athletes. But like I said, sugar can contribute to excess calorie intake, which can contribute to excess body fat. Sugar can be packaged with or without vitamins, mineral, and fiber. Think cookie versus fruit. So a lot of fruits and vegetables, actually anything that says it has carbohydrates all break down into sugar in the body, which is our main source of fuel. So now the nutrition label separates out a lot of the times added sugars, and that's what I would pay more attention to and try and limit. The recommendation is, I think, 10% of calories per day, but I think that's on the next slide. So some tips are choosing unsweetened beverages. Try adding less sugar to your coffee or your tea. So if you're someone who adds, 2 or 3 tablespoons, try cutting back a tablespoon. And then if you, after adjusting to that, try cutting back another tablespoon. So soy is safe, contains phytoestrogens, does not behave like estrogen in the body. It is a source of complete plant-based protein. It does contain fiber and is fortified with calcium. So it can help supplement calcium in the diet if you're not getting enough. Calcium is actually shown to be protective against colorectal cancer. So for estimated needs, women 31 through 50 need about 1,000 milligrams. 51 and up need 1,200 milligrams. I don't know why I didn't include the recommendations for men, but they're about similar. Dairy and fortified soy alternatives contain calcium. If you want to avoid dairy, you can do leafy greens, tofu, sardines with the bones, and tahini is also a good source of calcium. So one thing that I like to teach my patients is the My Plate method, and it's a way to set up your plate so that you're balancing not only your macronutrients, but your nutrition. So you want to make half of your plate a combination of fruit and non-starchy vegetables. You don't always have to have fruit. I prefer to have my fruit as a snack. And then on the other half of your plate, you want to take your starchy vegetables or your grains and put them there, and the quarter of your plate protein foods. And then you can add in dairy as you see fit. If you want to have a glass of milk, have a glass of milk. If you want to add some cheese onto your potato, have some cheese on your potato. This method is a little tricky with things like casseroles where you have a lot of mixed things. So if you have, let's say you have lasagna, you have a little bit of protein in there, you got some carbohydrates in there. So one thing I would do is I would add some non-starchy vegetables. They could be like, it could be a side salad, or it could be some zucchini that you saute, or it could be both. The American Institute of Cancer Research recommendations. So their first recommendation is be a healthy weight. I don't want everyone to focus on this scale per se. I want you to focus more on the things that you can control. Like I want you to focus on, are you eating healthy, nutritious foods? Are you being physically active? Don't stress about the number on the scale, because it can do more harm than good if you're stressing about it. Stress is a big factor in your health as well. So don't stress so much about the number on the scale, but think about your lifestyle and is it contributing to a healthy weight or a non-healthy weight. Their second recommendation is be physically active. They recommend about 150 minutes a week, which if you break it down turns into a 30-minute walk 5 times a week. So if you walk for 30 minutes 5 times a week, you meet the baseline for physical activity. Yes, you can do more, but if that's what you're comfortable with, start there. You can also start lower if you're someone who hasn't been active in a very long time. Start off with maybe 5-10 minutes of walking and work your way up slowly. You want to eat a diet rich in whole grains, vegetables, fruits, and beans. So we talk about a plant-based diet. Plant-based does not mean vegan, does not mean vegetarian. It just means that the majority of your nutrition is coming from plant foods. So your fruits, vegetables, and whole grains. You're having your meat if you are someone who likes to consume meat, poultry, fish, and then some dairy if you're someone who can tolerate dairy. If you can't tolerate dairy, I mean, they make dairy alternatives out of everything nowadays. But when you do look at the dairy alternatives, look at it compared to what you're replacing it with, or what you're replacing. So for example, if you can't drink milk and you want to drink something else, I would look at the calcium and the protein content. Some things are not fortified with calcium, some things are not high in protein. I know soy milk is comparable to cow's milk. And then yogurts. A lot of people replace their yogurt with a plant-based yogurt. And when I've looked at the nutrition labels, they're not that high in calcium. Some don't have any protein. Some are pretty low in nutrition. So when you do replace these foods for plant-based items, make sure you're reading labels and getting in some nutrition with them too. You also want to limit consumption of fast foods and processed foods that are high in fat, starches, or sugar. A lot of these foods contribute a lot of calories for a smaller portion, which can contribute to excess weight. I'm not saying that you can't ever eat fast food. I'm saying, every now and then you can have it. Try and limit it. Try and stick to the things you enjoy. AICR also recommends limit consumption of red and processed meat that I've already reviewed with you. Limit consumption of sugar-sweetened drinks. Like I've discussed, sugar is not inherently bad, but it can contribute to excess weight, especially if you're someone who drinks a lot of sugar-sweetened drinks. So if you're someone who drinks a lot of soda, I would cut back and drink more water, just because the water will hydrate you better. You want to limit or eliminate alcohol. And they actually say, do not use supplements for cancer prevention. There have been situations where supplements are linked to increased cases of cancer. For example, vitamin A and vitamin E have been linked to increases in lung cancer. So supplements are really to supplement the diet. If you're really eating poorly, then you can supplement your diet, but I would definitely discuss it with your doctor first. One vitamin that a lot of people supplement, vitamin D. It's pretty common for us where we live to be a little low in vitamin D. You can talk to your doctor about having your levels tested. That way you're supplementing appropriately. So supplementation in a way to correct an imbalance, that is acceptable, but it's not going to prevent cancer. For mothers, breastfeed your baby if you can. And after a cancer diagnosis, follow our recommendations if you can. I see a lot of people who have issues eating while they're on treatment. I have seen people have issues eating just due to the cancer itself. So just because they have these recommendations, if you're in a place where it's hard for you to eat, you're struggling with eating, that doesn't mean that you have to follow all these recommendations and you have to make sure that you're eating X amount of fruits a day. You may need to adjust your diet temporarily if you're going through cancer treatment, but hopefully that won't be an issue. So resources that are available to you. There is individual nutrition counseling. We have Valley Food and Nutrition, the outpatient dietitians. I actually know most of the outpatient dietitians. We actually just had a meeting. So I met with the inpatient dietitians, the outpatient dietitians, the home care dietitians. All of them are really sweet. There's also a lot of grocery stores now have a dietitian. I know the shop right by me has a dietitian and they list their hours. You might be able to meet up with them. I'm not sure how that works with insurance, so you would have to ask them. There's also eatright.org dietitian finder. So if you live somewhere outside where going to Paramus to Valley Food and Nutrition isn't convenient, your grocery store doesn't have a dietitian, or you just don't jive with them, you can find a dietitian using the dietitian finder. Other websites for reliable nutrition information are eatright.org, oncologynutrition.org, AICR.org, USDA.gov, and myplate.gov. I've gone to myplate.gov. They have recommendations for like calorie breakdowns for how many fruits, how many vegetables are recommended a day. Basically, the bare minimum I would say is 5 fruits and vegetables a day. That could be 3 fruit and 2 vegetable, 1 fruit, 4 vegetable, however it works out for you. The bottom line is to get in a variety of fruits and vegetables throughout your diet. You don't have to eat the same thing every day. Find ones that you enjoy and find methods of cooking them that you enjoy. You don't have to always have them steamed. You don't always have to have them sauteed. Add fats to them, like a little bit of olive oil or avocado oil, whatever you like, salt and pepper, because that oil will also help with the absorption of the fat-soluble vitamins that are in the fruits and vegetables. All right, so now is time for questions.
That was a very informative presentation. Thank you, Leigh. We do have several questions that came in.
Perfect.
So I am going to actually, do you mind if you can stop sharing screen, or maybe go back to maybe like your first slide? Yeah, that's great. Perfect. So the first question, how much protein does a patient need daily?
So protein intake actually depends on the person. It's a calculation based on your weight.
Okay, and then what foods are high in B12?
So your meat, fish, poultry, eggs, dairy are all high in B12.
Okay, and then next question, is turkey bacon just as bad as pork?
Yes. So I know everyone switches to turkey bacon when they say like, oh, I should avoid bacon, but turkey bacon is also a processed meat.
Okay, and then going back to alcohol and the risk that it poses on developing cancer, is wine, beer, hard liquor, all of it is the same as far as risk?
All of it is considered the same.
Okay. And then do you consider squash a starchy vegetable?
So squash, I think it depends on the type of squash, but for the majority of squashes, they are non-starchy.
Okay, and then actually, somebody asked if you could reshare the resources available. So if you could maybe put that up on the screen, that would be great.
Yeah. Oop, sorry. Went too fast. Okay.
That's perfect.
There you go.
Okay, and then a couple more questions just came in. Is there a way you can tell patients how to measure the portions correctly so they can understand the needed nutrients for themselves?
So actually my favorite method to teach is using your hand. And I always say your hand because I've had gentlemen who are very tall and I am 5'2". And so I hold up my hand and they get stressed. So your hand, the palm, use your palm to judge your size of protein. Your fist for like fruit. So an apple is about the size of your fist. And then your rice or your mashed potatoes is about the size of your fist. And then for fats, it's about the size of your thumb. And then for non-starchy vegetables, it's about 2 of your fists.
Great, thank you. Someone asked earlier if this is being recorded and will be posted, and it is being recorded and it will be posted either by the end of this week or early next week. So I did chat the website into the chat. I can do that again shortly, but there's just a couple more questions that are coming in. This person says, I have seen non-cured salamis, bacons, and pancetta. Are they safe?
So if they're not cured, they may be smoked still. So I would say those are still, and like the nitrate-free hot dogs and things like that, I would still lump in the processed meats category.
Okay, and then what are the categories of vegetables? For example, dark green or red and orange. What are some other categories?
So we'll go back to that slide. So dark green, those are a lot of your like leafy greens, spinach, Swiss chard, kale. Red and orange, that's your carrots, some of your bell peppers, radishes, beans, any type of bean, black bean, pinto bean, peas and lentils. You can do like the black-eyed peas, the red, green lentils, and then the starchy are your corn, peas, potatoes. And other is kind of like any vegetable that doesn't fit that category.
Okay, next question's 2 parts, but let me ask you the first part. Is it recommended to take a tablespoon of extra virgin olive oil a day?
So as just something to consume, it's not recommended?
It's the person didn't specify.
Okay.
Yeah, but just so you know, what the second part of the question is, if so, is it better to do that on an empty stomach first thing in the morning or in the evening before bed? I'm not sure in what reference the question is.
So I would say olive oil, I would use as a salad dressing. I wouldn't consume it on its own for any health benefits. It's the same with apple cider vinegar. I know they talk about apple cider vinegar and it being able to neutralize your stomach acid and all that. I wouldn't consume it by itself. Adding it to salad, adding it to vegetables to increase nutrient absorption, add flavor, that's perfectly fine.
Okay, great. And then another question, what about dairy? What are your thoughts as far as consuming skim milk, whole milk, cottage cheese, yogurt, kefir, those items?
So if you tolerate dairy, then I would say, if you tolerate it and you like it, then I would say go for it. The fat percentage of the dairy is really dependent on what other things you're eating. So if, for example, you eat a lot of higher fat items, then I would do a lower fat dairy. If you eat a pretty low fat diet, then you can get away with a higher fat dairy. Higher fat content will add to a nicer mouthfeel. So something like cottage cheese might be a little bit more creamier and a little bit more palatable at a higher fat content versus a lower fat content. And the same goes with yogurt. So some Greek yogurts can be a little too tart or tangy, but if you play around with the fat content, you might find it a little more palatable.
Great, and I think we've come to the end of all of our questions. So thanks so much, Leigh, for your very informative presentation this evening.